Hi, Corey. My name is Allison. I'll be the nurse practitioner seeing you today. I'm just going to go over a little bit of a health history review on you, do a head to toe review of all your systems, and make sure that everything's going the way that it should be. What brings you in today?
Just an annual checkup.
Okay. So, how are you feeling overall?
I'm good.
Good. Do you have any concerns at this time?
Nope.
Good. So, I'm just going to go over your current medications with you. As well as allergies, past medical history, family history, things of that sort. Okay. So, do you take any prescription medications?
Nope.
Do you take any medications over the counter that the provider did not write for you?
Yes.
What would those be?
Claritin.
Okay. Why do you take the Claritin?
Just for allergies.
Okay, like seasonal allergies?
Yep.
Okay. So now do you take any herbal medications or like multivitamins or anything like that?
No.
Okay. So we'll get to your allergies. Do you have any allergies to any medications?
No.
Good. Never had any severe reactions to any meds? Good.
Nope.
Allergies to food?
No.
Okay. And then you said you have seasonal allergies. Have you had seasonal allergies, basically your whole life or?
Yes.
Okay, good. Okay, so I'm going to start with your past medical history. Do you have any like current medical issues that you're having or have been diagnosed with?
No.
Okay. Any significant illnesses that you can think of?
No.
Okay. Any immunizations? Have you had the shingles, pneumonia, flu, COVID vaccine? Do you take any of those? Okay. What surgeries have you had in the past?
None.
So you haven't had any like teeth removed? Did you have your wisdom
teeth removed?
Okay.
Yep.
Do you remember how old you were when you had that done?
Like 16.
Okay.
17.
Have you been hospitalized for anything?
No.
Like had to stay overnight in the hospital? Okay. And anything traumatic, like any car accidents or anything like that?
No.
Good. I'm going to go over your family medical history. It's okay if you don't know, a whole lot about your family medical history. Some people do, some people don't. Is your mother still alive?
Yes.
Okay. Does she have any significant medical history that you can think of?
No.
Okay. How about your father? Is he still alive?
Yes.
Okay. Any significant history on him?
Nope.
Okay. Your grandparents, are your grandmother still alive?
Yes.
Okay. And then how about your grandfathers?
Yes.
Good. Okay. Any history with them that would be notable for me to write down? Any heart attacks, anything like that?
Nope.
Okay. All right. Do you have any siblings?
Yes.
Okay. How many?
One.
Good. Brother or sister?
Brother.
Okay. Any history with him? Medical history with him?
No.
Okay. And then do you have children?
Nope.
Okay. So now we're going to just kind of go over some personal history. We'll kind of focus on your support system. So are you married, single, divorced?
I'm married.
Okay. Do you have a wife?
Yes.
Okay. So no kids. Where you live, do you have a good support system around you besides your wife?
I have my dad and my grandma.
Okay. So where do you work at this time? Do you have an occupation?
Yep. T-Mobile.
Okay. How long have you worked there?
3 years.
Okay. Do you have so T-Mobile is more like kind of a mental job, not really a physical. You don't do a lot of physical work.
Right.
Okay. Do you have a lot of mental strain at T-Mobile?
No.
Okay. So we'll talk about your home. Where do you live?
In Worcester.
Okay. What kind of house do you live in? Like, do you live in a single story, 2-story?
A multi-story home.
Okay. Does it have like quite a bit of stairs?
Yes.
Okay. How many stairs do you think it has?
2 flights of stairs.
Okay. So you get a lot of exercise walking up and down those stairs. Do you have any pets?
Yes.
How many?
I have one. I have a dog.
A dog? What kind of dog?
She's a border collie.
Okay. How old is she?
She's 8.
I bet she's fun to play with. Border collies like to play. How much traveling do you do? Do you go out of the? Have you been out of the country?
I have.
Where have you been?
To the Bahamas, and we went to Haiti.
Okay. Have you had any exposure to diseases since you went any of those places?
No.
Okay, good. Are you sexually active?
Yes.
Okay, and are you heterosexual, homosexual, or bisexual?
Heterosexual.
So now I'm going to kind of just go over like your diet, your exercise, stress, things like that, just to kind of get an idea of, generalized what kind of habits you have and what you would be at risk for. So an example of a diet for you, if you can't really name like a diet, you know how some people can say like they don't take in any salt or anything like that. You can give me an example of like a typical dinner for yourself.
A typical dinner would probably be a big piece of chicken, rice, and a bright glass of water.
Okay, that's pretty good. That's pretty uncommon. Do you eat a lot of snacks?
Yes.
When do you like to eat your snacks?
I like to eat them when I'm not supposed to in the middle of the night.
Okay, but do you eat regularly, or is your eating pattern irregular?
I eat regularly.
Okay.
3 times a day.
Okay. Do you exercise?
No.
No? Okay, besides walking up all your stairs in your house? Okay. What about stress? Do you have any significant stressors in your life that would affect daily activity or anything like that? No? Okay. So how about your sleep? Do you sleep well at night? Okay. How many hours do you think you sleep at night?
Probably six or 7.
Okay, that's pretty average. How fast do you think it takes you to fall asleep?
Just a few minutes.
Well, that's good. You're pretty fortunate to be able to fall asleep that fast. Do you think you wake up a lot in the middle of the night?
Sometimes.
How often would you? 1 time a night, 2 times a night, if you were to average it out?
Once.
Just once? Okay. So, it's important for people to do healthy, like, screenings on themselves to make sure that they don't have anything, going on. Like with females, they do self-breast exams and things like that. Do you do self-examinations, like, on your prostate or anything like that? Okay. Do you smoke tobacco?
Nope.
No? Okay. Have you ever?
Nope.
Do you drink alcohol?
No.
No? Not a social person, not a drinker, not a smoker?
No.
Okay. Any street drugs, social drugs, anything like that? Good. And then I will ask you, we ask everyone this, do you feel safe at home? Have you ever been abused, threatened, emotionally, physically, sexually, anything like that? Okay, good. So now I'm just going to kind of complete a general survey on you, ask you a couple questions about how, like, your overall health, how you're feeling, and kind of go over head to toe, make sure everything's okay. So have you been having any fevers, chills, night sweats, fatigue, body hurting all over, changes in your weight?
No.
Okay. I'm going to ask you questions to check to make sure your mental status is intact. Can you tell me your full name?
Corey Brinkerhoff.
Okay. Can you tell me your date of birth?
9/21/94.
Okay. Do you know where you're at right now?
Yep.
Can you tell me?
I am in the living room.
Okay. Do you know what year it is right now?
Yes.
Can you tell me?
2026.
Good. Okay. Who is the president?
That would be Trump.
Okay, so some people, those trip people up because you're like, yes, I know where I'm at,
Yes.
but we just have to double check. So do you have any problems with your skin? Are you having any bruising, itching, rashes?
No.
Any concerns there? Have you had any injuries to your head, headaches, any dizziness?
No.
Lumps like on your neck or anything like that, pain when you move your head back and forth. Okay. Eyes, do you have any drainage coming from your eyes?
No.
Blurred vision or pain?
Nope.
Do you wear eyeglasses or contacts?
Yes, I wear glasses.
Okay. Excuse me. Do you wear glasses all the time?
Yes.
Okay. Your ears. Are you having any earaches, any drainage from your ears, or hearing loss?
Mm-mm.
Okay. Any changes in your smell, any drainage or discharge coming from your nose, anything like that?
Nope.
Any trauma to your nose, like when you were a kid? Did you get busted in the face with anything? Okay.
Mm-mm.
Any problems with your mouth, like any sores, bleeding gums, toothaches?
Nope.
Good. Throat, are you having difficulty swallowing? Hoarseness, changes in your taste,
Nope.
anything like that? Any shortness of breath, coughing, are you producing anything when you cough? Any chest pain, palpitations, or fainting?
Nope.
Palpitations would be like you feel like your heart's skipping a beat. Okay. Any pain in your belly, having any diarrhea or constipation, acid reflux?
Nope.
Okay. Almost done. Are you having any problems urinating? Like, are you urinating a lot? Urinating in the middle of the night? Urinating on yourself?
Nope.
Okay. Any pain with your penis, any discharge, prostate enlargement, or anything like that you're concerned about? Are you having any pain, stiffness, and limitation with the way you move your joints? No? Okay. And then having any numbness, tingling, or seizure-like activity?
Nope.
Okay. So, no pain present at this time. Seems like that you don't have really any concerns, any complaints, like you said.
I'm good.
So that's really it. It seems like that, this is just kind of to get you set up and make sure that, everything goes good. We'll do annual visits and make sure that everything stays the same. So I appreciate you taking the time to do this with me. And we'll get your appointment scheduled for next year and we'll see you soon.
Thank you.
Thank you.